much for being here today. My name is Naomi Amudala. I'm a nurse practitioner. I work at the University of Pennsylvania Vasculitis Center. I've been there since 2018, and prior to that, I was actually in Boston at the Boston University Vasculitis Center, and I've been there since 2009. So total, almost 15 years working with patients who have vasculitis. This is the first VF symposium I've been to, and I'm very excited to finally have made it here after all these years.
Well, we're glad you're here too, Naomi. I'm Jen Gordon. I was diagnosed with EGPA in 2014. I am a co-principal investigator of the VPPRN, and I know Naomi from going to the clinic at Penn. So we wanted to talk to you today about working with your providers and how to make the most of your medical visit. We want to leave enough time for lots of Q&A and interaction, so we're just going to jump right into it. So first thing, to try to get everybody started, think about how your medical visits go. Here are some options. When you see your provider, it's all over in a flash and whoosh, I'm out the door. What just happened? Things are rushed, but I'm able to take care of the most important things. I have enough time to cover all of my questions. Or D, my provider and I have all the time in the world. So who would say A? Anybody here? How about D? I would like to know who your provider is. So everyone else is somewhere in between. What about B? Okay, that's good. And C? That's great to see. So many of us either can take care of the most important things or have enough time for all their questions. So we know we have limited time with our providers, so the goal is to plan according to that, right?
So I think, we all wish we could live in category D, but unfortunately that's just not the reality. And so the question is in that time that you have with your provider, how are you making the most of that time? And so this is just what we're going to go over for the next 45 minutes or so. Self-advocacy, how to be prepared, being honest, and effective communication. So just a note first, I think we did a poll in the first session of where everybody is in their health journey. And actually, I think Sarah did a fantastic job about talking about all the things of identity change and accepting the diagnosis, and then how does that frame you and how does that change your life, really? But I think it's important to just acknowledge that. So a lot of times people who are maybe first diagnosed, maybe you pride yourself on never seeing the doctor at all. Maybe you go once a year. Maybe you've never even known a pill box, and all of a sudden you're going from that lifestyle to this whole new kind of way of life. And that's not to be underestimated. It's profound and it's impactful, and I think it really needs to be acknowledged. There's also sometimes a loss or a change in identity. You think, okay, I'm not able to be the parent I was, or work the way I did, or be a caregiver or a spouse, and that can be hard, I think, to accept, but it's learning that you're still the person you are, right? But there's maybe a phase of life that you're going through, and things are a little different for you. So learning the language. One thing I think we don't do well as providers is we use a lot of acronyms. We just use a lot of words that we expect you to know, and a lot of times you have no idea what we're saying, and you shouldn't. So when you're diagnosed, you get this kind of crash course in immunology and pharmacology, and you're learning about meds that you've never heard of before, and it can be a lot, and I think it can be very overwhelming. And I want to say that if there's ever a word that your provider uses or a phrase that you don't understand, it's okay to just say, can you explain that to me? I don't know what a CT scan is. I'm not sure what a PET is. It's okay to ask that and ask for clarification. We have to mention insurance because that's the bane of everyone's existence. So sometimes before you can even start to feel better, you have to do battle with insurance to get your medications, and that can be really hard. And then finally, self-advocacy. And again, this was touched on so beautifully in the first session, but many of us are not good at advocating for ourselves. And so I think that, having an idea, what are your short-term goals? Maybe you just want to be able to make breakfast for yourself the next day. And then what are your intermediate goals? Maybe, you want to come off of prednisone. You want to be able to go back to work, things like that. And then long-term goals. You want to run that marathon that you couldn't do. You want to take that trip that was canceled. Having an idea, what does success look like for you? What does health look like for you? And then sharing that with your provider. So that's a lot, and often that's all kind of packed into that 20 minutes that you have with your provider. And because there's so much that takes place during that time, it's really important to have a good sense of what you want to accomplish and how to do that effectively. And so I think that's what we're going to really talk about now for the next few minutes.
So this is supposed to be part of the Victory Over Vasculitis campaign on self-advocacy, which I lead. So let's make sure we all know what we're talking about with self-advocacy. So advocacy, advocating for or supporting a cause, a person, a thing. Self-advocacy is doing that for yourself, right? We might be really good at doing it for others, but the question is, what about doing it for yourself? And what does effective self-advocacy look like? And this might be different things to different people. And then think about also what the barriers are. What might be stopping you from being a good self-advocate? And hopefully, as we go through the talk, you'll... So first I would ask the question, are you a good self-advocate? Are you a good advocate for your own health and well-being? What do you think about that? Sometimes people are really good at advocating for their family members. You fight like hell for mom or dad who's elderly, or your kids, or your spouse, but what about for yourself? And what would your loved ones say about your level of assertiveness when you're in the provider's office or you're dealing with something? Do you want to improve? Are you satisfied with how you are? And it's really hard to do this, and it's especially hard to do it when you're not feeling well. You got to go in there when you're at your weakest, and you have to somehow make it happen. So the first question is, where are you now? This is a rating. You can see different levels. I think we're missing level 5 on our slide. So if you look in the red all the way up to green, you can see that people can consider whether they are disengaged and overwhelmed. Sometimes this might happen when you're at the early stage of diagnosis or you're not feeling well. Then you might reach a point where you're aware, but you're still struggling with how you're acting as a self-advocate. Then moving over, you may begin to take more control and gain confidence, and then maintaining your behaviors and pushing even further so that you can become a very strong self-advocate. So can I ask, by a show of hands, at what stage people think they're in right now? Who would say that they're a level 4, a great self-advocate for themselves? Yeah, I think I'm a great self-advocate, but I'm still learning, and I'm going to try to get better at it. Anyone would say that they're a level 3? Yeah. Level 3, that's great. We have a lot of level 3s. What about a level 2? Maybe some people that are still new to the vasculitis, the whole process may be lower. Anybody would say they're a level 1? Maybe hard to look at that and hard to admit that. And maybe they didn't want to come to the talk either. They may not even be at the conference. Those of us who are attending the conference, I think, want to become better self-advocates and learn and grow and figure out how we're going to deal with vasculitis. Naomi, did you want to comment anything here?
I do really like this rating. I've told Jen that several times. I think this is great. The one thing I would say is that this isn't a static moment in time, right? So if just because you're a level 4 now doesn't mean you're always going to be a level 4. We all have good days and bad days. And I know I can see sometimes when people come in how much effort it took just to be at the appointment. You feel terrible and you don't even want to be there. And maybe those days, maybe you are a level 1, even if you've been diagnosed for many years and you have a good kind of sense of what's going on. And those are that's okay. You don't always have to be at the top of your game. And maybe the level 1 days, that's the day that you have your family or your friends there to support you. Maybe that's the day when you really, if you have a good relationship with your provider and you trust them, you say, you know what, I just can't think about this right now. What do you think is the best move for me? What's the best decision to make? And those days are okay to have. You don't always have to be at the top of your game. Nobody is. So just a note, so I think now we're going to kind of segue into how to be prepared for your visit. And it's not just for scouts. And I think as we've kind of touched on, one of the key points or ways that you're prepared is through self-advocacy and really having a good almost agenda or sense of what you want to accomplish when you go into the visit.
So one of the things that I like to talk to patients about is making sure you're prepared for the appointment and that you sit down before and you plan what you're going to say, because if you're not clear and concise, you'll find that the provider is going to interrupt you. And in most of the time, it's known that providers will interrupt the patients about after 12 seconds. So why do they interrupt you? Because you're either going on too long, you're starting with like back in 1975, such and such happened, or you're not getting to the point and they're trying to move you along because they're not getting the information that they want and that they need for you, and the clock is ticking. So if you plan it out, you sit down, you say, okay, what's my elevator speech? What's my 2 minutes? You walk in, they say, how are you doing? You say, oh, how are you? No, they want to know, like, how are you doing? You say, okay, I'm doing this has happened, this is not. They will listen. They will not interrupt you if you're telling them relevant information. So this is a little checklist, and these are kind of the basics. And we're not going to talk about the basics today. These are the things that if you're an experienced patient, you probably already have done most of this, or you've figured out how to do this. Making sure that you have your list of medications that you need refills on, what labs you need to schedule, et cetera. What do you want to get done in the appointment? How are you doing? Being brief and honest. Any problems that you're having? And a list of questions that only the doctor can answer. Sitting down the day before, if you're going in with a care partner together, making this list. But what we really wanted to talk about today was more about the mindset and how you're communicating. Because you can prepare all this stuff, but you still need that aspect of the relationship building with your provider and being able to communicate effectively. And sometimes those are the harder, softer things that you need to focus on.
A note on telehealth visits. So maybe the one silver lining that came out of the pandemic is that we now have telehealth available. How many people do telehealth visits with their providers? Just curious. Yeah. There's a time and a place for it. And so, is telehealth appropriate and safe for you? What I would say is if you're having any new symptoms or anything that maybe needs actually a physical exam and you are scheduled for a telehealth visit, my recommendation would be to just send a message to your provider and say, hey, I know I'm scheduled to do a telehealth. I have this new symptom. What do you think? And then it'll be up to their discretion to decide. But some things just can't be captured through telehealth. And if that's the case, then you deserve and need that physical exam. Also, if it's been a while since you've been seen in person, maybe it's been a couple years post-COVID, you should probably be seen in person for that. And then do you feel comfortable using telehealth? Not everybody does. Not everybody has has the device to use? Are you in a safe place? Are you in a place where you can speak and not worry about being overheard? But for that stable patient who's actually doing well, the well baby visit, like we like to call it, then I think telehealth is a great option for you.
Okay, so now we're going to get into it. Let's ask the provider. What if things get tense in the appointment? What if I have a disagreement? How do I approach this with my provider?
I think this is a hard question. I've been thinking about this for the past couple months. It's first of all, you're not always going to agree with your provider, and that's just the bottom line. It's at the end of the day, it's your body and it's your decision. What I would say is if your provider gives you a recommendation that you don't agree with, the first thing that I would do is ask for clarification. Maybe there's something that was lost in translation. Maybe not all the information was relayed in a way that is easy to understand. So ask to go into more detail. And then if it's still something that you don't agree with, then I think it's best to just be honest with your provider and say, I don't feel comfortable doing this, or I don't want to do this because X, Y, and Z. It's better to do that than to say, okay, and then go home and have no intention of doing it. Because then there's no plan in place, and there's no treatment in place, and then things get lost, and that's when sometimes things can start to spiral out of control. So I think it's always good to be honest, be upfront, and have that open conversation. And the provider should be respectful of the decision that you make. So we can turn the tables now and ask the patient.
Yeah, no, I think you said it best. You know, you just have to be honest about it. You have to be prepared to have a difficult conversation. Maybe practice a few sentences that you have in your back pocket. Say, you know, can I think about that? Or I'm not sure about that. Or we need to talk about this more. So that you can kind of stop that train. You know, you get in that train, you're at the appointment, and they start doing, okay, you're going to do this, and you're going to do this, and you're okay, and now you're out the door. Now, wait a minute, what just happened? I don't know why I didn't say something. So practice what sounds right to you so you can pull that out and be prepared. Yeah. Okay, so the first question is, are you being honest with your provider? So here's a question. You walk into your appointment and the provider says, how are you doing? What do you say? I'm okay? Do you say, I'm okay, but you're not quite really okay? Do you say, I'm okay, but you're not doing well? Or do you just tell them, I'm not okay? So I know most of us probably just say, I'm okay, you know, and then kind of wait for them to figure out, are we really okay or not, and how much you're going to share. So let me ask, how many people say, I'm okay, when they might not be okay? Anybody? Right, so how do you expect your provider to help you if you're not being honest with them? So the first thing is be honest with yourself, and then the second thing is be honest with the provider. And this is where you practice the night before, and you say, okay, how am I really doing?
So effective communication, this is a great drawing, actually, that Jen found of a 7-year-old drew this picture, and she's in the doctor's office with her mom, and then the provider's, it's kind of a classic stereotype, I guess, but the provider's back is to the family, nose is glued to the screen, furiously typing away, and I think we've all experienced this. I know I have as a patient, but then also as a provider. So, you know, your disease is complex. There's a lot of details. There's a lot of things to get down. And so will there be some typing involved during your visit? Probably yes. That's just the reality. But it can't just be a relationship with your computer screen, right? So your provider should be looking up, having eye contact with you, engaging with you, asking you questions. And those are all kind of signs, usually, of active listening. If you feel like that's not happening, then it's within your right to kind of hit pause and kind of come up with some phrases or some helpful things that will help them kind of engage with you, because nobody wants to be talking to a screen. So what are some things that you can do if your provider's not listening? This was another thing I've been thinking a lot about, and I would imagine that as a patient, that must be very hard and very frustrating if you're in a room and you feel like nobody's listening to you. And so I was trying to think of some things that you could do to help advocate for yourself. And I think phrases like, "This is really concerning to me," or "I think this could be my vasculitis. What do you think?" Or "I'm worried that my vasculitis is flaring because I have X, Y, and Z." And then making it interactive, making it into a question so that your provider has to engage with you. What do you recommend about this? Sometimes a steady stream of conversation is not always helpful, because those important nuggets of information that you're giving to your provider can get buried in that conversation. So having, maybe, as Jen was saying, kind of succinct questions, really thinking about how to formulate your questions and then waiting for them to respond. Those are helpful ways to engage, I think, with your provider. So from the patient's view, what would you say?
Yeah, I think you have to be prepared if something's not working for you to say, "This isn't working for me," or I have concerns. I don't think that you're hearing me. Let me repeat this again. And if you need to say it, because otherwise you're going to be kicking yourself later that you didn't. Right, so then that was, is your provider listening, like actually listening to you or typing at the computer? And then there's, is your provider listening to you? And if you really think your provider's not listening to you and you've tried, then maybe it's time to find another provider. That's sometimes the reality. So here's another, I'm putting Naomi on the spot again. Let's talk about second opinions. How do you approach that with your provider, and what are they going to think if you want a second opinion?
I think, I work at a major vasculitis center. We get a lot of people that come to us for second opinions, and a lot of our patients go to other vasculitis centers for second opinions, and I think it's always appropriate to do that. That's within your right. You have a complicated disease, right? A complex disease. And this is a small community of patients and providers, and we all collaborate and we all work together to give you the best outcome possible. And so it's very appropriate if you want maybe a different view on things, or you've read about a drug and you want to learn more about it, it's very appropriate to get a second opinion. Often, sometimes, you're maybe working with your local rheumatologist for a day-to-day basis, but then making those trips to the major vasculitis centers, maybe quarterly or annually or whatever it is, and that's also okay. And I think a good rheumatologist or a good provider is going to be comfortable with that, because again, I think having that collaborative care is so key. So,
yeah. So then, if you're the patient, what do you do? Well, there's certainly a respectful way. What do you think about a second opinion, rather than, "I want a second opinion," right? So try to work together. As Naomi was saying, your doctor should be open to this. Any of your providers that you see should not be afraid of another opinion. And in fact, many of them, you may not even know it, talk to colleagues about our cases. Many of us have seen more than one provider because we may have relocated or et cetera. So they all know each other, they work together, and then they interact with each other about difficult cases. So there are ways forward, even if you're not getting along with a particular provider, to find another provider, even within the same practice. Sometimes that's possible. Or to get a second opinion, and then the two providers can actually talk about your case and find out if anything was overlooked. And my experience has been, especially with the docs that are coming here and engaging with us, they're all very open to working together. We're all in this together.
Mm-hmm. That's right.
Okay, here's another tough one for you, Naomi. The breakup. We didn't want it to come to this. but it happened. How do I break up with my doctor?
That's hard. You know, it happens. So if you think you're the only one who has left your provider, you're not. It happens, and it can happen for a variety of reasons. Maybe your provider doesn't have expertise in your particular disease. Maybe your personalities just don't jive, and that can happen. Your provider, for better or for worse, often becomes a big part of your life, and so you want to be comfortable with them. You want to have a nice relationship with them, and so it's again within your right, if you feel like that relationship is not working, to find another provider. Sometimes, just speaking as a provider, patients just leave and they never tell you that they're gone, and then you start thinking like, I wonder what happened to that person. And it's actually nice to just be informed that, hey, I'm going somewhere else, because otherwise I worry about them, when they go and I don't hear from them. So you can say that you're leaving if you feel comfortable. You can say why you're leaving if you feel comfortable, but I recognize that can be scary sometimes. But sometimes it's good for providers to get some feedback, areas that they can maybe change or grow in as well. So again, if you feel like that's something you have to do, you're not the only one. It does happen sometimes. And just make sure that you're following with somebody who knows what they're doing, who has expertise in vasculitis, because that is sometimes difficult to find.
So I would just add that it's sometimes a good idea to think about, like, what do you want from your provider? Do you want a friend? Do you want, to be with the person voted most likely that patients want to hang out and have a beer with? Or do you want someone who's skilled in the art of treating people with vasculitis, right? I hope there are no surgeons in the room. I think I use this as an example, right? Do you want a surgeon has a great bedside manner and not very skilled in the OR? Or do you want a super skilled surgeon in the OR who whoosh comes in at 5 a.m., you never even saw them, or they send the residents, right? I'm looking for the skills in the OR. That's the goal, right? So you have to keep your eyes on the goal. And your provider doesn't have to be your friend. You have to find a way to work together to help you, right, in your treatment. So you may need to ask yourself, what are your expectations? Maybe the personalities don't jive, but again, if you're on target with the treatment goals and this is someone who's supporting you, fighting with the insurance company, listening to you, trying new things, whatever it is, that's the goal, right? So think about that. Yeah. And of course, no one wants the outcome of the breakup, but if it is for the best, then maybe it's time.
So I'm a nurse, and we like to triage. And so this is when I think of effective communication, you have to triage your visits. So what is the most important thing? If your provider hears nothing else in that next 30 minutes, what is the one thing that you want them to know and walk away from? And that's the first thing that you need to come up, what you need to say. Because, is this the next slide? Yes. So this is the worst thing that can happen. And it's happened before, where you've spent a good 40 minutes with somebody, your hand is on the door, you're ready to go out, you're an hour behind with everybody else, and then somebody says, oh, by the way, I coughed up blood yesterday. Well, you can't walk away from that. And so that's the whole thing. But really, it would be best for things like that, really important, relevant things to be said at the beginning, because that's when you're going to get the time and the thought process that you deserve. Yes.
Yeah, I call this the Columbo. Hey, doc, just one more thing. Okay, so we have a couple take-home points, and then we'll get into some Q&A. Prepare for your visits. Hopefully, we made that point clear. And think about what your needs and goals are. What are you trying to accomplish? Where are you trying to go? How can you work with your provider to get there? Practice in advance what you're going to say so you don't have to make it up while you're on the spot, because the communication is key. And then we want to revisit the advocacy ratings to ask you to consider where you would like to be, where you would like to go, and how you think you can improve, and give that some thought. And then I think that's it. We're into the Q&A.
Yeah.
Okay. Thank you.
Thank you.
So there's some microphones around. We're going to just open it up to discussion. Anyone have a story to share, good or bad, an approach that's worked for them? Share a little bit about how how you see yourself as an advocate or what you'd like to do. Yeah.
Oh,
Go ahead.
Go ahead.
You're closer.
Before I was diagnosed, I was already leaning towards my diagnosis, just based off of conversations that I had with other doctors, and just digging in and, reading a bunch of articles and things myself. And when I finally got diagnosed, I had this magical vision in my head that I was going to be handed a packet that was like, these are all the specialists you need to go see, and these are all the things you need to keep an eye on and watch out for, and and that didn't happen, of course. And but not only that, but when I asked about it, my rheumatologist didn't really know what to say to that. And so I ended up seeking advice from online forums and other people that have experienced. I have Behçet's disease, and there's just not that many of us, and it's been really hard. But because it's so multi-systemic, the list of specialists that you need to see it's really long, and it's very varied. It's all over the board. And I guess my solution to that was to write that list of specialists myself and kind of run it by my rheumatologist, who actually, he's great. I really like him, but he didn't really have any feedback for this list. It was just like, okay, well, you can, get a referral for this person and this person and this person and this person. And, I finally have a neurology appointment in 3 or 4 months, somewhere down the line. And I guess all I'm really wanting to say is I wish that weren't the case.
Yeah.
I'm not bragging, but I'm at least savvy enough to know where to go find these resources and how to navigate, that sort of thing. And it has helped. I've seen a few of those specialists already, but I think even though it's been a while now since that happened, I'm still really disappointed that that's just not the case, So
we can certainly. I can appreciate that, and I think many of us have had that situation where the journey, right, the diagnosis was supposed to be the hard part, and now everything's just going to fall into place. But as we know, you have to take charge yourself, and sometimes you're the one who has to manage these things, right? And we're all learning, and I think that's why many of us are here, because our community, we can support each other to get there. Thank you for sharing that. Other comments, questions? Yeah.
Hi, I have hubs, and I thank you for what you're sharing. I think that the effective communication is something that's really I'm going to have to take to heart. I wanted to ask, in light of that, I've noticed that when I go back to my chart and I look at the notes, the symptoms that I had listed, whether, whatever, I'm not going to list them here, but I'll go back and they're not there. And then I'll call the nurse and I'll say, hey, I noticed that, this or that, or I'll put a note in my chart. And I get a little bit of resistance from that. And I've noticed that that's happening with more than one of my doctors. I have a rheumatologist, I have a dermatologist, and they're great. But I get worried, am I getting the right care if the symptoms that I'm having, continue to grow or expand, but they're nowhere in my record. Mm-hmm. And I don't know of an app that I can go in on a daily basis and check what's up with me, or take the data that my chart has, and I'm not an engineer, but build it all or save it all. You know, I feel to try and empower myself and understand all these complexities. By my chart's great. I'm just really struggling with that aspect because it's happened several times, and I'm struggling how to advocate outside of making those notes, asking those questions. Thank you.
I think, you know, in the past few years, there's been a lot more transparency in medical care, and people can now see their notes, which nobody's ever been able to do before. And there's empowerment that comes with that. There's also sometimes, not all the time, but some confusion. There's sometimes anger because you're saying that's not what I said, and this is how it was reported in the note, and that can be hard. I think we're pretty good at capturing most of the symptoms, but sometimes not all. Sometimes symptoms aren't documented for a variety of reasons. Sometimes it's because they feel that maybe it's not relevant to the story or the diagnosis. It's hard to know, and I can understand why that would be frustrating, especially if that feels important to you. But and again, what's captured in the note is not always an accurate portrayal of everything that happens in the visit.
I would make a few quick suggestions that if I had that happen with my notes, the next time I see that provider, I would say, hey, I noticed something was missing there, and either they would say, oh, sorry about that, or they would tell you why they didn't think it was relevant to what you have in there. And then if you've got lots of stuff, like especially if it's new appointments, I make a PowerPoint deck, and one of my providers is here. When I first went to see her, I brought her a whole printout of notes and things and summary and stuff. If you've got a list, print it out. You know, not like they don't want 400 pages, right? But if it's like a couple summary points or what your symptoms were, and you just jotted them down, you have them on your phone or whatever, print it out and hand it to your provider. They may appreciate not having to remember everything or having to write it all down while they're talking to you, and see how it goes.
Hi there. I'll apologize to the panel and to the audience if it's a dumb question, but it relates to safety labs. My rheumatologist had made it very clear that safety labs have to be drawn at regular intervals. However, I find myself keeping track of when they have to be done. So I know when they need to be done, but my rheumatologist isn't telling me when they need to be done. So my question is, respectfully, I'll direct this to our NP, whose job is it?
Well,
Not that I'm not happy to work together.
No, I think you raise a good point. Now, not to be snide, but at the end of the day, it's your liver, it's your body, and so it is ultimately your responsibility, I would say, to make sure your labs are being done. That being said, if your provider is not ordering the labs or following up on them or reviewing them, then that's not okay. I think I would feel very unsettled if I was getting labs done and they were just going into some void and I didn't know that they were being checked or reviewed. So it's a team approach, right? It's a collaborative approach. So having the provider make sure that the labs are there to be done at regular intervals, but then on you to remember that you need to be doing them every 2 or 3 months or whatever it is.
And if I could just follow that up with one brief question. Are these new electronic medical record systems, these EMR systems, are they reminding these doctors of what they need to do?
Well, at least not mine, no.
Okay, thank you.
Well, but be careful what you wish for, because then they have to figure out how to turn them all off if it's not a test that they want you to get.
I wanted to share that I essentially grade my appointment after I've been through it with my rheumatologist. And one of the things that I assess afterwards is, have I touched on, in that appointment, a quick recap of what's past, where am I today, and what do I expect for the next 3, 6 months, or a year. So if I've really touched on something meaningful in the past, present, and the future, I think that is probably a good indication of a well thought out approach to the appointment.
That's a great tip, thank you. One of the things that I do is when I sit down before the appointment is I review where I am, and I say, okay, what's the treatment plan going to be? Is there going to be any adjustment? Can I guess what the provider is going to say? And do I guess right? And why we would do this versus that? So if they say something different, then I can say, oh, I'm curious why you chose this versus that, and we can have a discussion about it so that I can learn the thought process behind how they're making those decisions and suggestions for what we're going to do next. And almost all the time we're pretty aligned because I think I've learned a lot, but you never know. I'm learning all the time. Something new happens around the corner.
I really like that because I think often as providers, we go into the visits with our own agenda and our own view of what makes a good visit, but sometimes that's not always the same as what the patient's goals are, and I like that actually as something to keep in mind when I see patients.
We have time for maybe one or two more comments. Anyone else?
Hello? Okay. Hi, I'm newly diagnosed about a year ago, and I'm a nurse too, and just being on the medical side and now crossing over to the patient side, I mean, it's been quite an ordeal, and my heart goes out to the patients. I feel like, I mean, I've always had compassion for patients and everything, but I feel like this has been a whirlwind of changes for me, and I feel like even as a medical professional, like I was just overwhelmed by the diagnosis and, reading about it and trying to figure out where to go from there and just getting to know my body. And I just feel like with this disease, it's so global that we're almost obligated to advocate for ourselves, which requires, research and reading and reaching out to forums, that have really good, like there's a lot of people with vasculitis that can lend some, personal experiences to kind of help out with stuff. And because I just feel like my body has changed so much in just the 12 months that I've been diagnosed. Searching for the right doctors that have the experience with vasculitis and just being really picky and looking at reviews and all of that, like it's been quite a journey. And then, when labs have to get drawn, like I look at all the results and then it's like I'm the one that calls the doctor like, hey, this is up. What are we doing with this? Yeah. And then finding out what the plan is, like what's the plan? What do you want to do now? In my research, I've noticed that, this is what most patients are on. When are we starting X, Y, and Z? How long am I going to be on this for? And kind of sometimes you gotta be the one to advocate for yourself and force them to come up with a plan, or like you said, find another physician that is going to work with you to get you where you need to be. But yeah, it's been quite a journey, and I'm glad to be here.
It can be very hard too, I think, when you're not feeling well, and then to take on all of that is a lot. And sometimes I think it can be overwhelming, and there's a lot of pressure. Like, what am I not looking at? What doctor am I not reviewing? What medication or paper am I not reading? And I think sometimes there's just a lot of pressure that we put on ourselves to make sure we've covered all of our bases. So.
Okay, well, thank you so much. Thanks, everybody.